Hello again if you're coming from my introductory video about teething where I go through what are symptoms, what's normal symptoms versus what is atypical when you should seek the care from your pediatrician. If you want to watch that one though, you haven't actually watched it, I'll link it here in the cards for you. But if you're just joining me here for a pediatric dentist tips and mom hacks for teething management, welcome. I am Dr. M, a board certified pediatric dentist and mom of 3 ages 6 and under. If any of this info is helpful, be sure to hit that like and subscribe button and go and find me over on TikTok and Instagram as well at The Mama Dentist. Okay friend, you have probably found me perhaps at 2 a.m. in a fit of desperation with teething, and I'm here to offer you some things you can do quick and easily at home to help manage teething symptoms. The key takeaways are pressure and cold. So the obvious one that most people know about is silicone teethers. You can get them in tubes or in rings. You can chill some of them. Generally, we say to shy away from the ones that are fluid filled just because the fluid inside is not something safe for baby and it could get chewed through and they could swallow it. There is one exception that I really like by the Baby Frida company that I'll show you right here. That one I let my daughter have it because it was just so nice. It had a handle that wasn't cold and it had different shapes and she just loved it, and she would only chew on that with me when I was right there watching her chew it, but she really liked it. It is this one. It has like a little gel inside. You can see she's like chewed it flat. It is called the Not Too Cold to Hold by Frida. All of these I am going to link in my shop, and I have a little section called Teething. Everything is Amazon affiliate linked, and I would love if you would like to support me in that way. I may also link them in the description should I find the time to do so, but otherwise go to my website, themomadentist.com/shop. It will all be there under teething. One great teether tool that actually doubles later to help you with brushing teeth is called the Brushing Buddy. I have an affiliate link for that. It is linked in my shop. I don't think it's on Amazon. You have to go through their website, but the Brushing Buddy is this little silicone teether that they love, and if they use it as a teether, they're going to get familiar with it and be comfortable with it so that later you can use it for this other function. See its little tail? It is called a mouth prop or a bite block for when you start brushing teeth, especially when they get molars. It helps them stay open like this. So it's a great tool, and I'll go through it again later with brushing. Mesh teether bags with frozen vegetables or fruits can also be really great. You can use frozen breast milk or infant formula as well, and they're nice because you've got this little bag, or there are some that are silicone, kind of shaped like a pacifier with holes in them. There's these little teethers that you can put cold things in, and they're not going to risk chewing on some pieces that are too big for them, especially for a young baby, so that can be nice. What you do want to be careful though is that nothing is ever too cold. If something cold directly touches baby's gums, they can get a little frostbite or burn, so you want to make sure if it is something that's been truly frozen that you let it thaw a little bit, that is a bit more soft and not quite as cold. But that's why those little mesh teether bags, those silicone teether pacifier shaped things, are nice because it's not really directly in contact with baby, so they won't risk that burn if something is a little bit more frozen. Teether foods and crackers, so things also that are like chilled cantaloupe, beef jerky piece, celery, carrot, things that they can't really chew off big chunks when they only have 1 or 2 teeth that are coming in. Those can be nice for them to chew on because it provides some pressure, and pressure helps to relieve some of the symptoms of teething, makes them feel better. That's why they're going around and chewing on everything. So just give them something that's safe and good and helpful for them to chew. A cold carrot is a really popular one. Frozen, but not totally frozen, but like cold piece of cantaloupe can help too. And then nursing or using a pacifier can help. Some people do put a drop or 2 of water into a pacifier and freeze it, and then they'll let baby suck on that pacifier. I think that's okay to do, but nursing, pacifier, bottle, whatever you're using, they may want to eat a little bit more, use that a little bit more just for comfort. Remember, we talked about in the previous video about accessory nerves running from the mouth to the ear. So sometimes this still have a little bit of ear pain, and nursing, just kind of like when you're yawning or swallowing something up in an airplane, when you have funny sensations with pressure and some sensitivity in your ear area, that is why chewing, pressure release, those types of things can help with teething as well if they've just got some sensitivity with their ears associated with teething pain. Brushing or rubbing the gums is another way just to help with teething and provide some pressure for them. You can use a gauze or a little washcloth. Make sure your hands are clean, so wash your hands, and you can just wrap it around your finger. It can be cold. You can freeze it for like 15 minutes, flash freeze it so it's chilled, and just rub your finger on there, get it wet so it's cold. That kind of thing can help too. This is actually kind of an old wives' tale that you can rub the gums and help that tooth cut through more quickly. That may or may not be so, but just the pressure and relief provided by that pressure is something good to do and can help baby. Even brushing the teeth or brushing the gums as they're breaking through, that can help as well. You will sometimes notice bleeding as that tooth literally does cut through and you see that tooth breaking through the gums, and that's okay. That's just part of inflammation. You're not hurting baby. It may bleed a little bit as that tooth actually breaks through the gum tissue. But what I just showed you, that little washcloth, this is my favorite low-cost hack for teething. It is a knotted washcloth. And so when you've got a knotted washcloth, you can dip that knot into breast milk, into water, and you freeze it in the freezer for about 15 minutes. So it's cold, but it's not too cold that it's going to burn baby's gums. And then this part, the bottom part, is not going to be wet. It's not going to be cold, so they can hold it. That's the appeal of that other teether that I showed you, the Frida one. It has a holder that is not cold, and then the frozen part sits inside that holder. So things of that nature that are cold on one side but not cold where they can hold it can be great. And this one you already have at home and is really easy to make and use. The next thing to help is hydration. So babies can very quickly become out of sorts if they get dehydrated. That is why the symptom of diarrhea, vomiting, that is not associated with teething, and you need to seek out care from your pediatrician should they have either of those two things, and the risk is from dehydration. Now baby, if they are uncomfortable, may not be eating, may not be drinking like they normally do, and so they may become dehydrated just from teething. That is why you want to help them by hydrating them. You can also provide some relief, cold water or breast milk. So whatever stage or age your child is in, give them a cold version, whatever they are drinking. You can use a medicine syringe and just fill that up and give them little squirts now and again. You squirt, let me show you on this video. This is a little hack for delivering medication that I don't know if I have a video yet on it. If I do, I will link it in the card. But it is my mom hack for delivering medication, and you're going to aim for a spot called the retromolar pad. The retromolar pad is the pad of gum tissue on the bottom that sits behind the molars. Even if baby doesn't yet have molars, you can aim for this area. What you do is pretend if this is your medical syringe and you want to deliver medicine or water to the baby who needs a little bit of hydration. You're going to run it along their cheek, like so, back to this area. Back there. Let me show you when to type it on. What you are aiming for, now this one is adult and it's missing some teeth, but it's way back here. So this was their cheeks out here. You're running along the side of the teeth and aiming right for that spot. That spot, they're not really able to spit out unless you let them move that liquid forward. But if you take your medicine syringe, run it along their cheek, and aim it right here, they're going to swallow that. So that's how you can deliver medication, especially if you recline the child like into your arms a little bit. You recline them back, insert that right there, little squirts at a time, little bit at a time. That's one way to quickly, easily get them a little hydration and also deliver medication if you need to. The other pro of delivering medication that way is they don't taste it as much. So if they don't like the taste of medication, delivering it way back there can help. The other benefit of keeping them hydrated, it's going to manage that fever. When we become dehydrated, we get febrile. So that low-grade fever is going to be helped also by keeping baby hydrated. And then if all other methods have failed, you can move to medication. Tylenol or Motrin are generally the ones that I recommend because they've been around a long time, they are regulated, they are from reputable companies, and you can talk to your pediatrician first about whether or not and at what dose baby can take either of those medications for the management of pain, like with teething. Typically, we do not recommend that you use it. Again, the 2 to 3 day rule. You don't want to use it for more than 2 to 3 days. Motrin especially. Motrin is not safe under 6 months of age. So again, check with your pediatrician if your baby is able to have Tylenol or Motrin and at what dosage. It is usually based by weight that we're delivering it. So ask your pediatrician. They'll usually have a little printout they can give you of what dose by weight to give baby, but typically not more than 2 to 3 days. If you're wanting or needing to give it more than that, you need to go see your pediatrician and investigate why they're still uncomfortable, still having a low-grade fever for this duration of time, because teething should be brief. It shouldn't be longer than 2 to 3 days if it is truly only teething. Giving Tylenol or Motrin for too long can also mask symptoms of something else. So if say they have a low-grade fever, but it's moving to a higher fever, but they're getting Tylenol and Motrin constantly for these 2 to 3 days, if it isn't going away, you need to stop giving it and see your pediatrician because it could be something else and you don't want to be masking the symptoms of that other thing. Motrin too, if given too long, can lead to stomach upset. So you don't want to give that for more than 2 to 3 days either. Typically with my kiddos, I really tried to only give teething medication when they were very uncomfortable and having sleep disturbance with bedtime. I wouldn't give it throughout the day, only at bedtime. You could give it throughout the day, but just talk to your pediatrician again and see what works for you and your child. The next question I'm always asked is, what about homeopathic medications like Camellia and Hyland's and Dr. Talbot's and all of those things? And what I'll tell you is I am a little bit biased. I am much more like evidence-based. Pro-science is kind of my lean when it comes to my recommendations. I want to do what the AAP recommends. So when you follow me, that tends to be what I recommend. Do I judge you if you choose to give other things? No, but I want you to make a fully informed decision should you choose to do so. What shapes my recommendation, professional and also to my friends, I don't recommend giving homeopathic medications because 1, they're unregulated, and 2, there have been some pretty scary recalls in the not so distant past. For me, when my eldest was was first teething in 2017. That was when Hyland's teething tablets had a big recall because there were inconsistent amounts of belladonna found in their teething tablets. Babies were being presented to the emergency room blue and having seizures from these inconsistent amounts of belladonna. And that was horrifying. I was done then. I wasn't using them anyway. That's kind of solidified for me that I would not be using them. They now use not belladonna, but something called arnica, but that too hasn't been studied to be safe in children. How do I know that doesn't have inconsistent amounts? I'm just not comfortable with the regulation that is lacking around homeopathic medicines. I know FDA, whatever, there's lots of conspiracy theories around the FDA and they're not perfect either. Generally, I'm going with Tylenol, Motrin for teething. I don't recommend anything else. Should you choose to use something else, I would not use anything that has belladonna in it, arnica in it, any type of active ingredient that could have a negative side effect that we don't know, that just might have a sedative effect if there's too much of it, that type of thing. Benzocaine is another one. Do not give any type of teething gel or teething treatment that contains benzocaine. That by weight especially, you can give a whole lot to a little baby very easily and you get a complication called methemoglobinemia. You can Google it, really horrifying, can be fatal. There have been older kiddos with teething, so even around 5 and 6, deaths have happened because of methemoglobinemia associated with benzocaine overdose. So no benzocaine, no arnica, and no belladonna. Anything else, so like chamomile, soothing things, you're probably okay, but I still, again, it's not my first recommendation, but you're probably okay if you choose to do that, as long as it's from a reputable company, you know there aren't contaminants, they get inspections, they do quick recalls, those kinds of things. If issues come up, that is your choice as a parent, what you want to do. So for teething, is there anything that I, as a professional, as a pediatric dentist, and as a mom, recommend that you absolutely avoid? Yes. Trigger warning here, I am going to mention infant death, SIDS, so those types of things, so take a minute, fast forward, I'll put in the bottom description a way for you to go to a different timestamp away from this, but yes, I would absolutely avoid amber teething jewelry, especially amber teething necklaces. If you want to learn more, there's a great child safety advocate named Dani Morin. She is on TikTok, on Instagram. She's got lots of wonderful information out there. She has a blog post about amber teething jewelry. She's a big advocate for having it removed from stores because it is not safe. Her son, Deacon, at 18 months old, was strangled by his teething necklace. And it was individually tied beads and it had a release clasp, an emergency pressure release clasp. We see injuries like these. Children present to the emergency room choking on these beads, not just necklaces that they wear, but also the ones that parents wear. You have to be really careful. There is an FDA warning issued because of teething jewelry. So if you want to use it with full awareness of the risk of choking and of strangulation, even with a clasp, even if properly fitted. There is no good way, there is no proper way to fit a strangulation hazard. Even if it worked perfectly, it is not worth that risk, and I do not recommend them. But as an aside, they do not work by the way claimed to work. There are some that claim it works by kind of cultural, spiritual practice. That, I mean, I cannot speak to, but at least the scientific mechanism that many claim is through the release from Baltic amber succinic acid. When it sits against the skin and that skin is warm because they're teething, the claim is that succinic acid is released. But Texas Health did a study. It is 392 degrees Fahrenheit at which the temperature must be or higher for that succinic acid to be released. And unless baby's jack-jack, that is not going to be helpful. Children are not alive at that temperature. So it is bogus. That succinic acid is not released against warm skin at the temperature your child is at, even when they're teething and have a low-grade fever. So amber teething necklaces are something that many people swear by. They're like, I put it on and it was a difference. And we have to consider us as parents. Again, we have an impact. We are believing that this is something that we are doing. We're in the mommy group where everyone swears that it works, and we put it on and we think this is going to help. And because we are more calm and we think it's going to help, that is the placebo effect on us. And then our change in demeanor impacts baby. They are more calm and feel better too. So that's why in my other video I mentioned with all of these teething symptoms, we need to take a step back and watch our expectations as a parent, because if we're like, oh, are they teething? They sense that in us, and sometimes it can worsen the effect of teething symptoms if they are there. So try and just remain calm and cool and collected and be a comfort as much as we can for baby, even if it's 2 in the morning and we're exhausted and tired. I know it's easier said than done, but all of that is a roundabout way to say teething necklaces, though many swear by them, no one will ever convince me that they are safe, because they're a choking hazard. Even having individually tied beads, in my mind, that makes it more of a choking hazard because you're not going to notice. It's just a single bead that goes missing and falls off. You won't notice. If the whole necklace wheels came apart. People have pulled them out of kids' throats in the ER. I am friends with a lot of emergency room physicians on TikTok and pediatricians on TikTok, and they have all encountered numerous injuries, perhaps not fatal, but injuries, choking, near-death experiences from this teething jewelry, so it is not worth it. Do not do it. I know I went off on a tangent, but please, no teething jewelry. And then, as I mentioned earlier, no teething gels that contain benzocaine. I would also add to that list no arnica and no belladonna. Do not ever use a teething gel like Orajel that contains benzocaine. There is a baby one that doesn't, but don't use one that contains benzocaine, especially for a young, small child, because of the risk of methemoglobinemia. No benzocaine, methemoglobinemia. And then speaking to some of the old wives' tales practices of putting like alcohol, whiskey, tobacco directly onto the gums, please don't do that. I think that goes without saying, but just to be sure that I am saying that, don't put anything on the gums that might be unsafe for baby. Some of those things can even increase oral cancer risk later in life, so please do not do that either. Now, are you wondering when to take baby for their first dental visit? I've got the answer, and it is actually in a video that I already made. So I will be sure to put that here, and you can follow that to see when the American Academy of Pediatric Dentistry recommends your child first see the dentist.